Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. Today's video, or rather I can say next 2-3 videos, will be regarding the sexually transmitted diseases. Sexually transmitted diseases, STD, or venereal diseases, that is VD. These problems are occurring in some youngsters because of the exposure to the different, what you can say, the exploiting your intentions of the sexual urge and all these things. The people are visiting to the prostitutes and the girlfriends, and they are doing any sexual activities without any condom, and then they suffer from the sexually transmitted diseases, that is STD. So today, first we will start with the syphilis, but also I'm going to use the table how you can differentiate the different sexually transmitted diseases. We will discuss about the symptoms of syphilis and investigations, and also the management or the treatment. Myself is Professor Dr. Deshpande. I am MD in Ayurvedic medicine, but we have the integrated course, Allopathy as well as the Ayurveda. So we have the knowledge of both the sciences. Okay. So I am MD in Ayurvedic medicine, MD in Ayurvedic physiology. For paid online consultation or paid online classes, you can WhatsApp me on 922-6810-630. So let us start with the topic, venereal diseases or STD. So here are the complaints, and here is a spot diagnosis, instant diagnosis. This video is definitely useful for the medical students, for the medical professors and medical practitioners. Okay. So complaint, patient will complain single painless ulcer, no pain, but ulcer is there with firm base. You can definitely diagnose. This can be the syphilis. Spot diagnosis, clinical diagnosis. Okay. Syphilis ulcer is not paining. There is no pain, and that is the danger of this disease. The particular victim or the patient, he always wants to avoid to go to the visit to the doctor because he is in ashamed that I have visited to prosecute or the girlfriend, and I have got this particular venereal problem. So he is very shy and having some guilt feeling in his mind, and so he don't visit to the doctor unless and until that particular symptom is irritating or what you can say the troublesome to him. So here ulcer is there, he sees the ulcer, but there is no pain, so he just pull on, and sometimes that ulcer automatically heals. That is that problem. So be careful about this painless ulcer of syphilis. Now gonorrhea cannot be hidden. Gonorrhea you cannot hide because the patient has pus discharge through urethra and burning micturition. While he go to the urine, the severe burning is there. So patient cannot hide this disease. He has to go to the doctor and take the treatment, and then he is get cured. So this is the problem of gonorrhea. Okay. Then multiple painful ulcers with slough is chancroid. The name of the disease, chancroid. Here you can see here only single ulcer. Can you see single ulcer? But here multiple also painful ulcers. That is chancroid. Then beefy red ulcer. Beefy red ulcer with satellite nodules. That is granuloma inguinal. The name of the STD is granuloma inguinal. Then inguinal bubo, that is the lymph gland swelling with healed or active ulcer. Here it is a typical lymph gland swelling is there in your groin. So this is LGV, lymphogranuloma venerum. So these 5 important venereal diseases you can diagnose, differential diagnosis with the help of only symptoms without any investigations. So another some differentiating point, if the syphilis is a disease, incubation period is 9 to 90 days. This is also another problematic case because the patient has exposure. He has visited to prosecute or the girlfriend say 3 months back, and even he is forgetting all the things because he has no complaint, only with a single ulcer without pain, and it goes automatically. So this incubation period is too long. So the patient may forget the history that he has visited this, and that's why this ulcer has come. The organisms is Treponema pallidum. This is always MCQ important. Both the things are very important for the students when they are getting some MCQ, multiple choice questions. Then gonorrhea, the gonorrhea as well as non-gonococcal urethritis, the incubation period is short, 2 to 10 days. And the organisms are Neisseria gonorrhea, that is for gonorrhea, and non-gonococcal urethritis, that is chlamydial trachoma. This is also venereal infection, chlamydia trachoma. Okay. Then for chancroid, again incubation period is short, 3 to 5 days. Haemophilus ducrei, Haemophilus ducrei, the name of the organism. Granuloma inguinal, 8 to 100 days, long incubation period. This is Calimatobacterium, Calimatobacterium. LGV, lymphogranuloma venerum, 3 days to 3 weeks, and the infection is Chlamydia trachomatis. So I think this particular table is very useful for the medical students for MCQ purpose, okay, and differential diagnosis. Now, syphilis, we will discuss mainly, concentrate on the syphilis. All other diseases will come in the next videos. Gonorrhea will be there, chancroid will be there. Every video will be short, videos will be there. So syphilis, I am giving by these videos very useful information for general medical practice, GP. I am not teaching you the book picture, all the details given in the book. No, I am giving you only practical oriented information. Okay. Syphilis, two types, congenital syphilis and acquired syphilis. Okay, congenital, from the mother, the child is getting, the baby is getting the syphilis. Then stages of this acquired syphilis: primary syphilis, secondary syphilis, and tertiary syphilis. These stages are only there in syphilis disease of STD or sexual transmitted diseases. Okay, so this is a typical feature. Actually, I wanted to show you some urethral ulcer, etc., but because of the YouTube's regulations, I am trying to avoid. You can go on the Google images and definitely you will get the picture of urethral ulcer in syphilis. If you type syphilis ulcer, you will get hundreds of pictures in the Google images. I am not putting over here because of the restraint of the YouTube regulations. Primary stage of syphilis. After 1 month of exposure, there will be hard chancre. Chancre is nothing but ulcer. Hard chancre developed in genitalia at the site of invasion. Basically, it will be on the glans prepuce, coronal sulcus, and shaft of the penis. Anywhere this particular ulcer will be there. This particular lesion is eroded papule, which is firm and indurated, measuring from few millimeters to 2 centimeters. Local lymph nodes enlarged, discrete, rubbery, and painless. Most important is painless. Ulcer is also painless, and that bubo is satellite bubo is also painless. And that's why the patient avoids to go to the doctor. Secondary stage, if the patient is avoiding, he has not diagnosed, he has not taken penicillin injections, he has not taken treatment, then that syphilic organisms goes inside the body in a deeper tissue, and that is called as a secondary stage of syphilis. After healing of the first chancre, after 6 months, generalized infection in the body, patient will complain of malaise, tiredness, fever, headache, sore throat, sore infection, rash, various skin rashes on the body, whole body, symmetrical, coppery or rosary color, but no itching, no itching. In the mouth, here, if the oral sex has been done, in mucous membrane, here, painless, slimy, grayish ulcers and small tract ulcers. These ulcers are called as a small tract ulcers. See, you can see even the fingers, because of the during sexual activity, some people, if they have used the finger, then that is syphilis, finger chancre can be seen on the fingers as well. Secondary stage of syphilis, generalized lymphadenopathy, axillary lymph node enlarged, cervical lymph node enlarged here, cervical, then inguinal lymph nodes enlarged, all over, generalized lymphadenopathy, condylomata, very important word, secondary syphilis. Condylomata is a typical feature of secondary syphilis. What is that? Watery lesion appearing on glans, penis, perianal or vulval region. Syphilis can occur in females as well as in the males. Treponema pallidum, these are the microscopic structure feature or the picture of that organisms of syphilis, that is Treponema pallidum. Now, if still the treatment is not taken properly, syphilis will attack on the brain, on the nervous system, that is tertiary stage of syphilis. Tertiary stage, very dangerous. Lesion may develop anywhere, even in the skin, in the subcutaneous tissue, in the bone, on the tongue. CNS, central nervous system, the disease is called as a tabes dorsalis. Tabes dorsalis means CNS infection due to the tertiary stage of syphilis. Dorsal column tract will be affected. Tract of Gol and tract of Burdak are damaged. This is physiology. Tract of Gol, tract of Burdak are damaged. Sensory damage is there. Sensory system, ascending tracts are damaged. Sensory tracts are damaged. Okay. Sore on penis, that is ulcer. What is the treatment? Single painless ulcer with firm base, that is syphilitic chancre. You can definitely give injection benzathine penicillin, that is long-acting penicillin, 24 lakhs intramuscular in the gluteal region. Best to give in the gluteal region, but penicillin should always be given after test dose or after sensitivity test, AST. Because if you don't test this penicillin, some people, they get anaphylactic shock and they can die on the table itself. So be careful while giving the penicillin. Okay. Send blood for the VDRL test. This is a blood test. VDRL, Venereal Disease Research Laboratory, the name of the test. This is not laboratory. This is the name of the test, VDRL. You have to write down VDRL. If VDRL positive, continue the injection, this benzathine penicillin, Pencom, 24 lakhs IM every week, one injection for 3 injections. Locally, on the chancre, clean and apply terramycin ointment 3 times in a day. Sore on penis treatment. If the patient is sensitive to penicillin, what to do? Inject tablet erythromycin 500 milligram 4 times in a day, 8 a.m., 12 noon, 8 p.m., like that, 8, 12, 4, 8, etc. 4 times in a day for 4 weeks, 1 month you have to take on this tablet. Generally, usually we don't take the antibiotic for more than 5 or 7 days. But as this is a case of syphilis, the antibiotic should be given for minimum 1 month. Okay. If there has been a contact with the wife after the infection, treat the wife also. This is very important. Partner should always be treated in sexually transmitted diseases or in venereal diseases. Okay. Otherwise, infection will persist within the couple, from husband to wife, wife to husband. It will continue. Advise HIV test, AIDS, for all patients with venereal disease or STD. So my dear friend, this is all about the beginning of sexually transmitted disease discussion. We have differential diagnosis. We have made the differential diagnosis and also covered the important topic syphilis. But this is for the medical students, medical doctors, professionals, and for the general people to make a general awareness. But self-medication should be avoided. Conceivable disclaimer. यथावश्यक यथाकाल वैद्य की सलाह लेना जरूरत है. If anybody of you suffering from any disease like cerebral palsy, arthritis, MND, cancer, ADHD, hyperactive children, thrombocytic panic purpura, idiopathic thrombocytopenic purpura, cerebral palsy, any chronic or immunocompromised autoimmune diseases, and if you want a panel of expert doctors, we have the Ayurveda Academy. You can contact on WhatsApp 9226810630. So thank you very much. I request all of you to like this video, share this video, like thumbs up, and subscribe my YouTube channel Ayurveda Academy, and don't forget to press the bell button icon to get the information about my new upcoming videos. I wish all the best. Take care and bye-bye.